Did you know there's a condition that could silently deprive your body of oxygen without you even realizing it? It's called asymptomatic anemia, and it's far more common than most people think. Unlike typical anemia, which often comes with clear warning signs like fatigue, dizziness, or pale skin, asymptomatic anemia can sneak past unnoticed, leaving you feeling fine on the surface while your body struggles internally. This makes it a hidden danger, capable of causing serious health issues if left untreated. In this video, we're diving deep into what makes asymptomatic anemia so tricky to detect, why it poses a silent threat to your health, and the simple steps you can take to uncover and address it before it's too late. Stick around, because by the end of this video, you'll have the tools to identify potential risks, understand the causes, and even protect yourself with actionable solutions. Don't let this silent condition take you by surprise. Let's uncover the facts together. What is asymptomatic anemia? Anemia is a condition where your blood lacks enough healthy red blood cells or hemoglobin, the protein responsible for carrying oxygen throughout your body. Normally, people with anemia experience noticeable symptoms like extreme tiredness, shortness of breath, or a rapid heartbeat. But with asymptomatic anemia, there's a twist: it presents no obvious symptoms. This means you might go about your day feeling completely normal, unaware that your body is quietly struggling to deliver enough oxygen to vital organs and tissues. Most people with asymptomatic anemia only discover it during routine blood tests or health checkups. It's a silent problem, but one with serious potential consequences if left unaddressed. While the lack of symptoms might seem harmless, the truth is that asymptomatic anemia can cause long-term strain on your body, leading to complications over time. This is why understanding what it is, how it operates, and what causes and risk factors. Asymptomatic anemia doesn't appear out of nowhere. It often has underlying causes that are either overlooked or go unnoticed for years. Let's start with the most common ones. 1. Iron deficiency. This is the leading cause of anemia worldwide. It's often due to inadequate dietary intake, chronic blood loss from conditions like heavy menstruation or ulcers, or poor absorption of iron in the gut. 2. Vitamin deficiencies. Low levels of essential vitamins like B12 and folate can lead to anemia by disrupting the production of healthy red blood cells. These deficiencies are more common in people with poor diets, certain medical conditions, or older adults who naturally absorb fewer nutrients. 3. Chronic diseases. Conditions like kidney disease, cancer, or autoimmune disorders can interfere with red blood cell production, leading to anemia. For example, chronic inflammation in these diseases can suppress bone marrow function, which is why it's dangerous. Asymptomatic anemia might seem harmless because it doesn't show obvious symptoms, but beneath the surface, it can cause significant harm over time. The lack of oxygen in your blood puts quiet but constant strain on your body, leading to several potential complications. 1. Heart strain. Your heart has to work overtime to pump oxygen-poor blood to meet your body's needs. Over time, this added workload can lead to an enlarged heart, irregular heartbeats, or even heart failure. 2. Weakened immunity. Without enough healthy red blood cells to carry oxygen, your body's ability to repair tissues and fight off infections is compromised. This makes you more susceptible to illnesses and slower to recover from injuries. 3. Cognitive issues. The brain is highly sensitive to oxygen levels. Long-term anemia can lead to memory problems, difficulty concentrating, and even cognitive decline, particularly in older adults. 4. 1. Diagnosis and tests. Detecting asymptomatic anemia is easier than you might think, and it starts with a simple blood test. Since this type of anemia doesn't show obvious symptoms, routine checkups and screenings are often the only way to catch it early. 1. Complete blood count, CBC. This is the go-to test for diagnosing anemia. It measures several components of your blood, including a red blood cell count, RBC determines how many red blood cells are in your blood. O hemoglobin levels, indicates how much oxygen your blood can carry. O hematocrit, the percentage of your blood made up of red blood cells. 2. Ferritin test. This measures your body's iron stores and is especially useful for diagnosing iron deficiency anemia, even in its early stages. 3. Vitamin level tests, to rule out deficiencies in B12 or folate, which are common causes of anemia. 4. Peripheral blood smear. In some Treatment options. Treating asymptomatic anemia depends entirely on its underlying cause. Once identified, tailored treatments can restore your body's balance and prevent long-term complications. Let's explore the most common solutions. 1. Dietary changes. Incorporating iron-rich foods like spinach, red meat, beans, and fortified cereals can help replenish your body's iron stores. Adding B12 sources like eggs, fish, and dairy products, or folate-rich foods like leafy greens and citrus fruits, ensures your body has the nutrients needed to produce healthy red blood cells. 2. Supplements. Iron supplements, often prescribed for iron deficiency anemia, they can quickly boost iron levels but must be taken as directed to avoid side effects like constipation. Vitamin B12 or folate supplements, these are essential for those whose anemia stems from nutrient deficiencies, especially vegetarians or individuals with absorption issues. 3. Addressing chronic conditions. If anemia is linked to a condition like kidney disease or an autoimmune disorder, treating the underlying disease is critical to resolving the anemia. For example, patients with kidney disease might require erythropoietin injections to stimulate red blood cell production. 4. Blood transfusions. In severe cases, particularly where anemia is life-threatening, a blood transfusion may be necessary to quickly restore red blood cell levels. 5. Lifestyle modifications. Reducing caffeine and alcohol intake, which can inhibit iron absorption, and staying hydrated can improve overall blood health. The key to effective treatment is a personalized approach. What works for one individual may not work for another, so it's essential to work closely with a healthcare provider to develop a plan that targets your specific needs. Remember, treating asymptomatic anemia is about more than feeling better, it's about protecting your long-term health. Prevention and lifestyle. Preventing asymptomatic anemia involves a combination of healthy lifestyle habits and regular monitoring. A balanced diet is key. Ensure your meals include iron-rich foods like spinach, red meat, beans, and fortified cereals, which help replenish your body's iron stores. Additionally, consuming vitamin B12 and folate from sources like eggs, fish, dairy, leafy greens, and citrus fruits supports the production of healthy red blood cells. Regular screenings are especially important if you're in a high-risk group, such as pregnant women, older adults, or individuals with chronic conditions. These checkups help catch anemia early, even when symptoms aren't noticeable. Staying hydrated is also crucial, as proper hydration supports overall blood health. It's equally important to limit your intake of caffeine and alcohol, as these can interfere with iron absorption. By making these simple but effective changes, you can significantly reduce your risk of developing anemia and protect your long-term health. Call to action on asymptomatic anemia. Asymptomatic anemia may not show obvious symptoms, but understanding how to detect it early can make all the difference in preventing long-term complications. By recognizing the importance of routine screenings and lifestyle changes, you can take proactive steps to protect your health. To take control, schedule a simple blood test to check your iron, vitamin, and overall blood health. Early detection through these tests can prevent serious issues down the road. Don't keep this valuable information to yourself. Share this video with anyone who might be at risk, such as women of childbearing age, older adults, or those with chronic conditions. Empower yourself and others to prioritize health today.